The pharmaceutical industry has always been big business, and with a global revenue of €4.5 billion in 2017, Brussels-based UCB is more than well established in that field. Growth has been driven by innovation and a strong stable of core medicines. But nowadays, all the talk at UCB is of alignment, data sharing, and breaking healthcare silos, heralding an era where drug manufacturers, medical professionals, and even patients become more connected, working together. I'm Andrew Wilson. I'm here in Davos, ahead of the World Economic Forum, to speak to UCB. Welcome to the Business Debate. Dr. Tiwari, welcome. Good to talk to you.
Thank you.
Pharmaceutical companies, healthcare, it's a huge subject, of course. What are the challenges and problems we're looking at, particularly nowadays?
There are many challenges, but we tend to focus on challenges related to patient value. And everybody is trying to create patient value, right? But there are many problems with it. There is a problem around defining it, maximizing it, and measuring it. If I just go a little bit deeper on defining it, there is no consistency in how healthcare stakeholders define patient value today. A doctor sees value for patient in a different way than a patient would see value for him or herself. Let me give you an example. There was a study done by the University of Utah where they asked doctors and patients to actually list 5 important characteristics of value. The interesting thing is that in 90% of the cases, the patients mentioned a different combination than the doctors mentioned. So yes, we have here at the moment a siloed approach.
That's extraordinary, that they came up so widely apart from each other.
It's not only among patients and doctors. Across the healthcare environment, you have different definitions of value. Payers have a different way of looking at value as the pharmaceutical companies, as the regulators may be. Now, you can imagine that if there is a different definition among stakeholders, there is also, of course, a difficulty in maximizing and measuring it.
So what are the principal barriers? Why have these 3 arms gone so far apart?
Here again, there are many barriers, and they're actually all important. Information is key. When you look at communication, crucial, especially in between the silos that we see in healthcare. Trust is very important because without trust, you cannot progress. And at the moment, we need to work on trust between all the stakeholders, whether it's doctors, patients, payers, pharma companies, and regulators. And another one, of course, is data. Data needs to be connected. Let's look at this example. At the moment, 25% of patient data in the US is held in state and federal electronic records. A gold mine, you would say, right? So imagine if you could mine that, you would get real insight about treatment and how patients react to it. Today, it's of no use because these electronic records are not connected to the crucial clinical data repositories, so you can't do anything with it. So here you have it. You actually need to have better communication so that the healthcare stakeholders, right, start trusting each other and then share data. Data needs to be connected to be useful.
Of course, one of the problems you face is that there have been controversial episodes in the past concerning the pharmaceutical industry, which have led to people worrying that sometimes the checks and the regulations on new medicines are bypassed or insincere, or that the checks aren't properly done. And that makes the patient feel isolated. Is that something you need to work on, the trust for the patient?
Of course, you need to work on trust in the patients, but when the pharmaceutical industry will define value for patients through the lens of a patient, right? Trying to really get to know what is the need, what are the wants, what's the behavior of a patient, using tools like artificial intelligence and machine learning to truly understand what is the experience that the patient wants this value delivered, trust will be built. Because in the end, we are looking at patient value through their lens.
Is there a danger that artificial intelligence and machine learning, despite bringing a certain precision that we haven't had before into healthcare, run the risk of isolating the patient? They think they're being treated by an algorithm rather than by a human being.
Data is the new currency, right? You need to get data, deep insight about patients' needs and wants. But there is a lot of data available there, so you need tools to get the insight out to mine these data in an efficient and accurate manner. That's how we see the use of tools like machine learning or artificial intelligence. We have an example where we actually help doctors by using the power of predictive analytics and machine learning. We are trying to help doctors to come with a personalized treatment plan for epilepsy patients. This is how you use these new tools to gain insight and help patients.
And as far as UCB is concerned, how are you repurposing yourself to move towards that?
Well, UCB has recognized that healthcare is changing, right? Patients more and more are becoming consumers who are actually searching for best value. Why is that? The patient is getting more empowered through the internet. There is information available. They're taking charge of their healthcare, and they're looking for healthcare-related information on the internet. 4 out of 5 patients go on the internet to find healthcare-related information. On top of that, healthcare is getting more expensive, and in many countries, patients are asked more and more to pay more and more out of pocket for it. So of course, since they have the information, they are asked to pay more and more. They are going to search, like any consumer does, for better value. UCB recognized that, and we organized ourselves around the patient.
So where does UCB's vision for the future of healthcare fit into that?
The vision of UCB for a value-based healthcare system would be where the patient is at the center, surrounded by a group of professionals who are connected with each other, who are actually always thinking or having the patient in mind. At the same time, healthcare stakeholders realize that patients are consumers looking for best value. The silos, which cause problems with communication and cause wastage in the healthcare system, they are gone. And most importantly, when it comes to patient value, we have figured a way out to define it, to maximize it, and to measure it.
Dr. Tiwari, thanks very much indeed. Good to talk to you.
Thank you.